A warm welcome to everyone taking time out of their day to join me for Tuesday Tips with Taylor. Here at Always Best Care, we strive to provide quality care for our clients in the same way we provide care for a loved one. June 1st through the 7th is designated as National CPR and AED Awareness Week here in the U.S. Started in 2007, the goal of this week is to showcase the importance of CPR and AEDs during emergent medical situations. CPR, which stands for cardiopulmonary resuscitation, was first developed in 1960 following the start of mouth-to-mouth resuscitation techniques, which were developed in 1956. This, combined with an automated external defibrillator, or AED, which was first developed in 1930, is what we use in instances of sudden cardiac arrest. Every year, there are over 350,000 cardiac arrests that happen in the United States, with 90% of them being fatal, according to the Sudden Cardiac Arrest Foundation. A medical emergency can happen anywhere at any time. Knowing how to perform CPR properly and how to use an AED safely and effectively is vital. When recognizing an emergency, your senses will be in high gear. You may hear unusual sounds, smell odd odors, or see unusual appearances or behavior. The purpose of performing CPR is to allow more time and a higher chance of survival while waiting for emergency services to arrive. Chest compressions should be done at a rate of 100 to 120 compressions per minute at a depth of at least 2 inches for adults. Compressions help the heart to continue pumping blood through the rest of the body, and for every 30 compressions, 2 breaths are given to supply oxygen to the person's lungs. Time is very important because after 3 minutes without oxygen, brain damage can occur. An AED is a useful supplement to CPR because it helps determine a heart rhythm and then delivers an electrical shock to help the heart reestablish a normal heartbeat. AEDs are very simple to use because they provide verbal instruction once they're turned on. Organizations like the American Red Cross provide full training and certification on the proper way to perform CPR and use an AED, and as a licensed training provider for the American Red Cross, I'm able to provide that training within the community. For information on becoming certified in first aid, CPR, and AED techniques, reach out to your local Red Cross. If you're here with us in Connecticut, give me a shout to get your certification today. Thank you so much for joining me today. Remember, CPR saves lives, and I look forward to seeing you next time. Interested in learning more about our in-home care options or assisted living selection services? Give us a call at 860-533-9343. You can also find us on social media on Facebook, Instagram, and YouTube, or you can visit our website at www.abccentralct.com. Always Best Care has been in business since 2009, and it's where better options for senior living are a priority.